Hey everyone, it's Jerry at the Fledge. Welcome to another episode of Every Damn Day. And today on the show, I have a very special guest, a very special person to me. Pam, how you doing today?
I'm all right, Jerry. Thank you for inviting me to be a part of every damn day.
Well, I'm excited to have you. Every time I talk to you, I learn. Every time I see you, it gives me another way to be a better person. So
Well,
you,
thank you. Vice versa.
thanks. So, when we prep before the show, you're coming on and you're like, man, it doesn't stop. Or I can't remember that exact phrase that you used. Um,
Not
but
sure, but it's always on.
yeah, it actually made me think we're having a show tomorrow, and people are saying, why are you doing it on Christmas and all of that? And I keep saying to them that poverty doesn't stop on Christmas, harm or substance use doesn't stop, homelessness doesn't stop, abuse doesn't stop, all the social ills do not stop. So I'm not stopping, and I don't think you're stopping either.
No, as a matter of fact, my kids wondered why I was doing this today. And I was like, she's like, all you people that work in addiction, you don't even bother stopping for the holidays. And I was like, that's because addiction doesn't stop for the holidays. Like you said, everything else that people live, it continues through the holidays. And, if anything, people tend to, the holidays for most of us mean family, and that doesn't necessarily mean you're staying with family or going to be with family, but it means, it's a family holiday. So you see a lot of messages in our society about the fact that it's a family holiday. And most of us have things in our families that are either challenging or sad or patterns that are frustrating or, memories. And so holidays can be really challenging for people with addiction. Either it's challenging. I come from a family with a generational pattern of addiction, and the generation above me were pretty heavy drinkers. And
Yeah.
so, and actually, I've got other people in my family that are actually in younger generations who are pretty substantial drinkers too. And so when I would go around family holidays and there'd be a lot of alcohol, which was never my drug of choice, it would be sometimes really frustrating. And holidays can be frustrating for a variety of reasons, but typically drug and alcohol use increases all of our addictive behaviors. It's a holiday that's completely geared towards people with shopping addiction,
Yeah.
right?
Yeah.
Spending and shopping addictions.
So it's not on the screen. I want to make sure that everybody knows that Pam is the founder of Harm Reduction Michigan, and I want to ask you a couple kind of questions, not so related to Harm Reduction Michigan, but tell us something about you. And we really enjoy the where were you born and raised, where'd you go to high school, where if you went to college, where'd you go to college, and all that. Would you
All that
tell us a little bit about Pam?
Sure. Pam was born and raised in Traverse City, Michigan, and I went to U of M when I was 17. U of M Ann Arbor. So that was where I did my undergraduate degree. So that's a little bit about Pam. I can tell you
Well,
something Pam misses. My undergraduate degree was in Romance languages, and I don't really get to use them very much in Traverse City. And so I miss that piece of me a lot. And I've been considering beginning to substitute teach in French and Spanish because they're really at a lack of substitute teachers in Michigan right now. And it would
yeah.
kind of keep my toes in that, and probably brush up my skills in that. When I lived and worked in New Jersey or even Chicago, I had a lot of opportunity. I spoke probably more Spanish in the daytime in New Jersey in my job than I did English. And I also used Italian a lot. So that's really different than Northern Michigan. So I miss
Uh,
it.
I love learning new stuff about you, Pam. Um, so Harm Reduction Michigan.
Mm-hmm.
That's what you do. I mean, I need to say something to everybody. This is I get broken up around you all the time. You and I have
We might get broken up together, Jerry.
and so I'll just give everyone a warning of that. You're a big hero to me. You taught me more than anybody. Either whether
by 10 minutes into your show, we might
that's
both
all right.
crying.
That's okay, because the journey is tough, and everyone wants to see the journey, and they want to know how we got here. And I just want to tell everyone that. But would you mind telling us all the great work that Harm Reduction Michigan does, and any stories that you want about projects that you're working on or anything?
Sure. So Harm Reduction Michigan is an organization that really kind of started to come together in about 2009 or so. I moved back to Michigan in 2008 and had been doing harm reduction since about 1994 in other big urban areas of the country. And a group of people here who were familiar with harm reduction and who had been working in other areas of the country in harm reduction, myself, Maya Doe Simpkins, and then a couple of other women that were basically, we all founded it together, and all of whom had, personal relationships with addiction, whether it be drugs or alcohol, in their families or in their personal lives. And so when I came back here in 2008, I'd already been doing overdose prevention work for a decade. And it was very frustrating to come back to Northern Michigan and see headlines about people dying of overdose in hotel rooms and things around here, and know that that's completely preventable. And that to me is very, very frustrating that I had a decade of work with overdose prevention and a lot of tools and information, videos, and always a pile of naloxone. Yeah. Wherever I am, there's a big pile of naloxone, and was ready to distribute that throughout the communities of northern lower Michigan, or Michigan for that matter. I'm hearing some feedback. So I think it's gone now, so I'm assuming we're good. So long story short, I started to think about how I could put these videos, I have a lot of videos, and the knowledge that we had to use to help to start to prevent this issue from happening. And so I thought immediately about Michael Moore and the State Theater, which is a community theater in downtown Traverse City that he has adopted and, is basically volunteer run. And because they like to focus on a lot of community issues, I had a feeling that perhaps we could talk the State Theater into giving us a night to do an overdose prevention film night. And so that was really kind of our first big incident or event. And so I started, because I'd already been doing overdose prevention work for about a decade, I knew what people listened to and what brought their attention, what got their attention in talking about that subject. And so I started to put together like a panel of people that would speak after we showed the films. And, we had a researcher, because that's important to certain parties and public health and, academics. So research and data is important. We had a couple of medical doctors, one of which was the Bay County medical examiner, and had, any medical examiner anywhere in the United States at this point has seen their fair share of overdose deaths in people that are far too young to be dying of overdose. And we had, I'm trying to think. We had a therapist who had a patient who was kind of one of the first patients here to be really out about doctor shopping for prescription opiates. And then we had like the local hospital. And then I needed a parent, I needed a parent that could tell the story of losing their loved one, their child, to overdose death. And I knew people in New Jersey area that could speak to that on this panel, but I really didn't know people in Michigan yet. And so that could speak specifically to that issue. And so some people in Connecticut, no, I think they're actually based in Massachusetts. It's a parents group based there. They connected me with a man named Mark Rudolph, who was one of the founding members of Families Against Narcotics, which these days you don't hear about Mark Rudolph and some of the other founders. But Mark was one of the founding parents of Families Against Narcotics. And Mark has a really wild story, unfortunately, about losing his son. And so I reached out to Mark, and Mark agreed to come and speak at the State Theater about his son, Ryan, and the experience they had and how that all went for them. And Mark's got a really moving story, and he's actually got a clip of the phone call they received from whoever it was that left his son's dead body wrapped in a rug in a vacant lot in Detroit. And so this guy calls, and it was left in a voicemail on the mother's voicemail on her cell phone. And so they have that clip, and they played that at the State Theater. And, you know, you can sit and listen to doctors talk about it, and counselors talk about it, and researchers talk about it. But to me, the thing that people really remember and walk away wanting to do something about it is when they hear somebody who's had the personal experience of losing a loved one to overdose. And so we were really grateful that Mark, I think he has a website called Promise to Ryan with the number 2. And that's dedicated to his son. And so, like I said, he was one of the founding parents of the original Families Against Narcotics chapter in Macomb. And this was, like I said, about 2000. And this film festival was about 2009. And so, anyways, we're very grateful to Mark and his family that he was willing to share that story. And so what the interesting part is, you know, this was just some November night on a Monday night in Traverse City, because of course we had to take whatever night the theater was willing to donate to us. And that happened to be a Monday night. And it was fantastic because 274 people walked through the door of that theater that night. And not because they knew who Harm Reduction Michigan was. Actually, at that point, we called ourselves My Whosoever. And then we actually ended up changing our name to Harm Reduction Michigan. But people didn't come because they knew who we were or for any particular speaker on the panel. It was just such a huge issue that people were facing here, and they were not getting the answers from the usual suspects because, you know, the treatment providers were not doing Narcan at that point. The health departments didn't know Narcan. What are you talking about? They didn't know anything about naloxone distribution to drug users and their loved ones. And so people couldn't just go to the health department and get a Narcan kit, or to Catholic Human Services, or any of the people that they would traditionally know to ask about addiction issues. And so people didn't have answers, and people wanted information, and people were looking for help. And so that's why 274 people came through the door of that theater that night to watch those films and hear those speakers, you know. And another founding member of Families Against Narcotics, her name is Susan Gregory. And I really attribute the founding of FAN to her and Mark. And Susan's son, Denny, died in the Farmer Jack's bathroom in Sterling Heights. And, you know, he was like 20 or maybe not even. And Susan had never heard of Narcan or naloxone. And I remember she made such a strong impression on me because when it came to the Q&A part of that night, Susan stood up and she said, you know, sorry, I feel like I'm going to get emotional.
I'm already there.
But she said, you know, I don't understand. I'm watching these movies about naloxone, and I have such a mixed bag of emotions. She said, you know, I'm really happy to hear about naloxone and happy to hear about this cheap available tool. And she said, but the other part of me is just really angry and furious. Why am I hearing about this at the State Theater in Traverse City, Michigan? Why didn't I ever hear about this before? Why didn't my health department tell me about this? Why didn't the treatment providers that we've taken my son to tell me about this? Why didn't Denny's friends have this medication and reverse his overdose with it? There was a pharmacy down the hall in the Farmer Jack's where Denny died. And she said, you know, why didn't they have this medication at the pharmacy of Farmer Jack's? Why couldn't they have responded to my son's overdose with this medication? And she, you know, understandably had a real mix of emotions about learning this information. And it was pretty cool because a couple of years later, it was in 2013, we went to Washington, D.C. to testify for the Food and Drug Administration about making naloxone more broadly available to communities across the country. And Susan testified essentially saying that, why did I have to go to a film festival in Traverse City, Michigan at some community theater to hear about this? And it was pretty cool because she was quoted in Time magazine, as her testimony was quoted. And so we're grateful to her also for sharing that experience and having so many people learn from it.
Yeah. Can I want to talk about a couple things, because you're using the term harm reduction, and to you and I, it is very clear what that means to us. And I think I want to kind of talk about harm reduction versus some of the whole war on drugs and the whole, just say no, and the whole abstinence thing. And, why did it take so long? Why? I want to know why too.
Well, Jerry, honestly, I think you do know why to some extent. And I think it's challenging because I think we're in a situation currently where many of the people who are interested in the status quo remaining as it is are benefiting from the status quo. And so they're anxious about changes. They're anxious about new information. And most of that comes because some of the changes would require them relinquishing power and money and funding, and they don't want to do that. Unfortunately, I think we've seen it in the change of administration. We're seeing it right now in the supposed change of administration in our country. People in positions of power and authority aren't real often excited about giving those up.
Yeah.
And that's exactly why you haven't seen this move more quickly in a lot of places around this country. As a matter of fact, the GAO just issued a report. I think it came out like last week, where they analyzed the different states, and they analyzed these huge pots of money that have come from the federal government to respond to the opioid crisis, and looked at how much of it has been spent. And Michigan alone, I haven't had the time to peruse that report as deeply as I plan to over Christmas break. We talked about Christmas break. Oh, that's right. We don't really do a Christmas break because we work in addiction and we care. But anyways, whatever little time I have, I plan to spend more time looking at that report. But Michigan has $68 million that has not been spent from this federal opioid fund, and there have been a few different years. And so it's cumulative, and it's not unique to Michigan. There are a lot of places across this country that have not spent their big opioid dollars. And that's a whole nother discussion in and of itself. But, harm reduction is a pretty broad term. We have to keep in mind that changing to a harm reduction perspective or a harm reduction way of doing things is a paradigm shift. And so paradigm shifts are something that takes decades, and it's a process. So kind of like addiction, we know that an acute intervention is not the solution to addiction because it's a chronic illness. And so you can't handle a chronic illness with an acute intervention, like putting somebody into treatment for 30 days or 90 days. That's an acute intervention for a chronic illness. It's not going to work, right? So we think more about addiction like diabetes or obesity than we do. We need to change our thinking to think about it more in those ways. So changing to a harm reduction approach or a harm reduction perspective is going to take time. And it's a process for people to understand it and to understand the thinking and the way to approach things. And so that's not something that people can get in like a one day session on harm reduction, or, a 2-hour video on harm reduction. There are a lot of great videos on the internet about harm reduction and about different harm reduction interventions, but you got to know who to listen to and who not to listen to. And, but it's also a process over time. People need to gather as much information and absorb as much information that, over time they build that up and come to a different understanding and how to take this different approach to handling addiction. Unfortunately, the war on drugs has probably done more damage than it's done good. And that's tragic because, people have suffered a lot. But we currently have a situation where many of the solutions that we set up to try to help people with these issues are, in fact, instead further traumatizing people. And I can definitely say that as a clinical therapist through time, I have seen people who are traumatized by the criminal justice system, traumatized by the prison setting, and also traumatized by medical professionals, traumatized by clinical professionals. So it's unfortunate when we have a situation where, for my first experience for substance abuse treatment for myself, when I was 24, I put myself into treatment for my birthday. And I was kicked out of there 2 days early because I wouldn't agree to what they wanted me to agree to. And I was not physically, but verbally, I experienced, sexual impropriety from my therapist. And so I didn't trust him, because I knew that a therapist shouldn't be saying the things to me he was saying. And so instead of working successfully with my therapist, I shut down because I thought, okay, this guy's inappropriate. And if I tell management, who are they going to believe? The dope fiend or the therapist? And so I didn't tell management because I didn't see any point in telling management. But I did tell some of my peers that were in the program with me. But needless to say, when he was being verbally inappropriate with me, my walls went up and my trust went completely out the door. And so when he's telling me at the end of my 30-day treatment program, I want you to do this because that's the only way you're going to get clean and stay clean, I'm looking at him like, I can't trust you. I'm not going to listen to anything you say, And so when people are in, like, there's a very small example, and frankly, it was not a good treatment experience because, like I said, I couldn't trust him, and he was my primary therapist. In other ways, was it a good treatment experience? I learned about treatment. I learned about myself. So in those ways, it was a good experience. But as far as it being the type of experience that we would all hope our loved ones would have in treatment, absolutely not. And so when people are being further traumatized by the system that's supposed to be helping them, we're not getting anywhere, and just, we look at how we've handled this opioid epidemic, and we are, when we take kids and take them away from their parents or lock their parents up in jail because their parents have an addiction issue, we're further traumatizing everybody involved. And so right now we are not handling things in a way that makes things better in the long run.
I met a young lady this morning. She's her cousin got arrested and is in jail, and they took the kids, and she's got the kids now, and she's suffering from substance use. And I gave him a bike.
Good.
Where'd I get that bike?
I think you maybe got the bike from Harm Reduction Michigan.
I sure did.
So yeah, we were excited to be able to have a place where the bikes could be useful, because we have some places in the state have a lot of resources, and this happens to be an area in Traverse City. I'm here because my mom is elderly and she's here, so I'm kind of stuck here for a while. And it's a pretty wealthy community. I mean, from my perspective, it's a pretty wealthy community. And I used to tell my kids, just because you guys don't have the same amount of money that the kids in school have, doesn't mean you're poor. By the world standards, we're all wealthy in America, or most of us anyways. Yeah. And so anyways, I would see all these things thrown out with the garbage, or, bicycles just strewn aside on the road or left in people's yards and that kind of thing. And so we started collecting bicycles, and there's a guy here who recycles old bicycles and donates them to people in the community who need them. But he was actually maxed out. So everybody was like, the recycle a bicycle guy isn't taking bicycles anymore. And so it seemed like a really good idea to take bicycles and get them fixed up and then take them someplace where they could use them. And so I asked you guys if you had any use for some bicycles that, you know, were put in good shape. And we were really fortunate because the person who started working on all the bicycles for us was a person who was in a reentry program at the time. And I was just looking for people who maybe needed a little bit of money and needed a little bit of income. And, you know, most people with felonies have a hard time finding jobs. And so it just, you know, the universe synchronistically brought this person from the reentry program around, and that person can fix anything that I've thrown their direction. And they were doing like super detailed stuff to fix those bikes just right before we brought them down there. And so we were excited to bring one delivery of bikes, and I anticipate having another delivery of bikes in the spring too. And then we've got some skateboards and scooters too.
Oh, hell yeah. We want some skateboards for sure.
Cool.
So since some serendipity happened there, because I didn't know the story about the guy who was working on the bikes and that he was coming through a reentry program, because we split the bikes in two and we gave half of them to kids who had a parent that was suffering from substance use disorder or had passed away from an overdose, and we gave the other half to parents who had, or to kids who had a parent incarcerated as part of our reentry work.
That's fantastic. And that was my hope, you know, because I know that unfortunately sometimes, you know, people are in a situation where they just don't, you know, if it hadn't been for my student loan money, my kids wouldn't have had new bikes, you know, and it was very hard to be able to afford bikes, you know, when my kids were younger, and they grow fast. And so it's hard to keep them in a bike that fits them. And so I knew that there might be people that could use these bikes. And so we're glad that you guys were able to put the bikes to some good use.
Yeah. And thank you again so much for that. And, you know, my story I've told on this show before. People know that my daughter died of a fentanyl overdose after a long bout with substance use disorder. And she left 4 little ones behind, and I got to open presents with them before I came to the show today. So that's what I was scrambling around about, but can't complain about being busy when that's the busy.
That's great. So you're constantly surrounded by little people. I
am. And you know, you have a place in my heart, and you hit on a couple of things that I just want to make some statements about. One is, when all of you out in the crowd hear me complain about how the institutions are not being effective, they're protecting their salaries, they're protecting their jobs, you know, Pam teaches me a lot about that and a lot about my view on that. And when, you know, you talk about, you know, when we talk about systemic racism and people making room for others, it's not just making room for others, it's making room for ideas that are effective and knocking the institutions out of the way, because they do get in the way. The war on drugs was billions, maybe trillions of dollars, and nothing. It got worse and worse.
You know, I mean, it's kind of like the defund the police movement, right? I don't think, you know, that's a very delicate discussion, right? But if we could just eliminate the no-knock warrants, eliminate the crazy paramilitary tactics that go on with drug raids, that's really expensive. The equipment is very expensive. And you really don't want law enforcement acting or behaving like that. I mean, even in the worst of situations. And I look at different European countries and different societies, advanced societies on our planet, and they don't handle things like that. You know, one of Michael Moore's movies, it's called Where to Invade Next.
Yeah.
And he has different segments about very successful social programs in different countries. And if you ever have the chance, or if the audience ever has a chance to check out that video, you want to check out the segment about decriminalizing substances or addiction, you know, hard substances, as they did in Portugal. But the interesting thing is that they interview the police, you know, and the police are just like totally calm, like yeah, if they want to use drugs and mess up their lives, it's their right to do so. We're not going to arrest them, and they're not all worked up about it. It's not like, like what happens with our police. It's like, no, we don't need to have that kind of an amped up, angry law enforcement officer. That's inappropriate. So it's really wonderful to see the police in that particular video talking about decriminalizing substances, and their manner is just so interesting. And then there's some other movies, from Canada and other places where the police just, talk about their work with people with addiction. And when you see people who work in towns, like there's one film called Through a Blue Lens, I think it's what it's called. And it shows law enforcement trying to teach about harm reduction in Vancouver. And a lot of hardcore long-term substance using people who've got some pretty substantial medical consequences to their injection, things like giant abscesses and things like this. And, the law enforcement officers are just saying, at one point they came into a girl's apartment who was having a lot of health issues. And, she shared with them a photo album of her family, like growing up, and like, they're seeing pictures of her, like as a, twirling a baton when she was a little kid. And like, they're looking at these pictures and they're going, this girl grew up just like I did. And like realizing that at some point something happened in her life, that she's reached for this coping skill that in fact has really kind of turned into a negative. It's in and of itself. And that, by understanding that she was a person just like them, who grew up pretty much just like them, they had a very different perspective on how you help people. And I think these kinds of things can be very helpful to law enforcement here. I think sometimes I see it in harm reduction is that when people have not heard of other ways of doing things, they don't realize that there's other ways of doing things that work really well. And, in fact, it builds camaraderie and it builds respect, and it can be very successful. And so I think sometimes it's just a question of exposing people to other ways of how things are being done in other places. And that could be some great success in our country.
And I want to go, you brought the street nurses of Vancouver with their beveled up to the fledge. And that just, it had such an impact on me. I talk about it all the time. It's one of my proudest moments to have met.
Caroline?
Meeting you. Yeah, but meeting you is like, you're a superstar in this world, and you're my hero. And that night, that movie had such an impact on me. It changed me to the point where on my show on the 26th, I think it is, I've got a young man who is working on gun violence, and we're using harm reduction techniques. We don't know. Yeah.
Yeah. So harm reduction can apply to a lot of different things. We talk about a seatbelt in a car. Like, they realize that a lot fewer people die from car accidents when they wear their seatbelts. So they made a law that everybody should wear their seatbelts. And so, some people don't wear their seatbelts. But when you put on your seatbelt, you're practicing harm reduction. By putting filters on cigarettes, that's a harm reduction move. It helps people not absorb as much tar as people would absorb if it didn't have a filter on it. So there are harm reduction things that are a part of our everyday world and that we have adopted in general society. And it's quite interesting because as harm reduction takes hold as perhaps a way of doing things with people, so not as many people are dying or not as many people are getting Hep C or HIV, it's also very hard for people to understand what harm reduction is. And a lot of times, because harm reduction for addiction has typically involved things like syringe access or overdose prevention, people think that harm reduction is about people continuing to use, and they don't realize that it also includes abstinence-based 12-step recovery, because it's a continuum. And at one end of that continuum is the abstinence-based approach to addiction. But then there's a lot of other points along that continuum, but it absolutely could be applied in many other subjects. So this is wonderful. That's great to hear. I'd like to tune in for that one for sure.
Yeah.
Very important.
I think so too. And he's a great young man. I often have people introduce me as, oh, jury can help them get off drugs. And I don't think, oh no, that's way too big, first of all. But it's actually not really what my goal, my first goal is. My first goal, my biggest goal would have been to keep my daughter alive for 20 minutes and to get that ambulance there. She was in the quality dairy bathroom for 26 minutes, not breathing, not responding, and no Narcan in sight. And my big goal is, if the average ambulance time is 9 minutes and someone is nodding out, let's get them breathing for at least 9 minutes and get them breathing again for 9 more if we have to. And to me, it's really about keeping people alive so they have that second chance, and not just, it's not addicts. It's not, we use these words addicts and junkies and, all these things that create stigma that you and I kind of try to avoid those words. I guess sometimes we probably use them. I use them with guys sometimes. But, it's somebody's daughter, it's somebody's son, it's somebody's brother, mother, sister, uncle. It's touching all of us more and more and more. And I think people, I want to ask you what your mission is, though it seems very obvious, but I bet it's not to the crowd as obvious as it seems to you and I.
Our mission as an organization is to work in alliance with the communities that we work to empower. Because what we also see is that, typically speaking, lots of the people that these programs are created for are not at the table. Mm-hmm. And so, I don't think that it's kind of not very effective if I'm building a Puerto Rican cultural center. If I want any Puerto Ricans to come to my Puerto Rican cultural center, I probably want to have a Puerto Rican person helping to build that Puerto Rican cultural center, right? And right now we've got a lot of programs for people with addiction in this country that people with addiction are not at the table, or when they're really trying to start a lot of syringe access programs around the state of Michigan, oftentimes the people that the programs are created for are not included in the conversations about how the program's created. And so how can you, sitting with a master's degree or a PhD in an office, when you've perhaps never been a person on the end of the spectrum that's actually using these services, I don't know how you could think that you could create a program that is going to be effective when you need people who've walked in those shoes to be at the table. And so that's one of the reasons why Harm Reduction Michigan was created, was because, I haven't done it yet. But part of what my mission is to help our society understand that, in fact, my plan is to change the perspective on addiction completely. Right now, we have a situation where, like I said, many of the things that are supposed to be helping people are actually making people worse. And my theory is that addiction is and should be a developmental stage. That's a complicated conversation. And It actually requires a whiteboard, and I'd be back here showing you, which we're not going to go into right now. But it's a developmental stage.
But at the end of the day, my brain has to recover from a lot of different trauma factors and maybe the chemical factors and all these things to get me to the next stage, to get me to the next stage, to get me to the next stage. And it's not just zap, say no to drugs.
Right. Absolutely not. And when you have a lot of the people who are supposed to be helping that don't understand that it's a developmental stage. And my theory is that how we treat people while they're in that developmental stage will determine if they ever get out of that developmental stage, or if they die first, or if they just get stuck there for a very, very long time and never get out. And what bears upon that is how they're treated while they're in that stage. And that's on us. And so that's really my mission, is to change that perspective. Because in fact, it's not the disease of addiction that's the bigger problem. It's everything that happens to people because they end up in situations that really make things much more difficult for them, like getting charged with possession, and then, ending up with a minor in possession. All of these things, you quickly get into a situation that's a hole that's very hard to get out of. And depending upon how much help and support you have in the society and in your immediate family, and in your community, you may get stuck there for a very long time, and it's really tragic. One of the more recent places where we've opened office is Cadillac, Michigan. And I can see a huge difference. I would have thought that, like back when I lived and worked in New Jersey, and I was about the only white person in the room, and, lots of diversity, but, and speaking Spanish most of the time, right? There's a lot of diversity in this country without any question. So if I'm back in that mindset and I'm thinking about Northern Michigan, I'm thinking Cadillac, Michigan, Traverse City, Michigan, pretty similar places, like kind of largely the same kind of population. But in fact, there's huge differences between the places. And it's because in Traverse City, there's a lot more places where people could try to get help. You probably have about a dozen doctors who do medication assisted treatment. And even though there's a lot of shortcomings I'll just say it, I feel like there's a lot of shortcomings in the traditional substance abuse treatment system. In Traverse City, you have a half a dozen places you can get different ideas from, and lots of 12-step meetings of every kind all day long, multiple times a day, and multiple places around town. So there's a lot of places you can get help. So it's really different. Just, I'm thinking, gosh, how crazy that two towns that are like less than an hour away from each other, that are predominantly white in Northwest Lower Michigan, are this different. And it's because of the amount of help that's available in Traverse City and has been available in Traverse City versus the lack thereof in Cadillac. So it's really also about how that immediate community treats this disease and provides help and support and resources to helping people understand it and make changes, or make healthier decisions.
Yeah. So I'm going to try to keep us moving along, because you got lives to save, and I mean that sort of literally. But I want to make a comment about a couple things just to my crowd, because they hear me talk about very similar things. When I talk about, the solution that works in Traverse City is not the same exact solution that works in Cadillac. It's because the resources are different. The causes might be similar, but the solution you need to implement is going to be different. And that's why we have to localize problem solving, and why you entrepreneurs are so important in solving the problems within our community and finding the resource and figuring this all out, and then making something that's sustainable. You can't plop a Traverse City solution into Cadillac, if you don't mind me saying that, and as close as they might be. But I want to keep this rolling for you so I can get you back to what you're doing. What's something you do every damn day to push that mission forward?
Well, we try to help people that, one of the things Harm Reduction Michigan likes to do is we like to hire people that might not be able to work other places. And that's because of either lots of arrests, or, a certain type of criminal record, or people who have a long history of injection drug use themselves. From my perspective, who better to be a phlebotomist than a person who's got lots of years of experience as an injection drug user? And so what we did is we trained injection drug users or former injection drug users. Some are current and some are former, as phlebotomists. And so we literally sent them to a school in Southfield, not one any closer than Southfield, and got them certified as phlebotomists, because most people who have a long history of addiction don't have veins, and it's really embarrassing when you go to the lab at Munson Hospital to get your blood drawn and they can't get a vein. And sometimes people will be nice about it. And even the ones, sometimes you'll get some people that want to be nice about it, but they're really just not sure how to be nice about it. And so it'll come across as judgmental, even when they're trying to be nice about it. And because even when somebody's like trying to draw your blood and they're trying to be nice about it, if you feel bad about why your veins are so bad, or if you have regrets about the amount of time that you spent as an injection drug user, or if it brings up bad memories or challenging thoughts, or you have friends that died of overdose and other things. I have a lot of friends that died of HIV AIDS. And so anyways, then, all those thoughts come to the front of the person's mind who's getting their blood drawn. And so it can be a really challenging emotional experience for people. So when they come to Harm Reduction Michigan to get a blood draw, the person drawing their blood is a person who is also vena compromised, meaning they don't have good veins either, because they were also an injection drug user. And so it really kind of turns into a very different thing. People don't have to be ashamed. People know that that other person has been opiate dependent. They've been an injector. And so they know what it's like when somebody tries to get blood from them. And so they're very respectful and helpful when the person, it's just a very different thing than going and getting your blood drawn by someone who doesn't understand injection drug. You're like, how could you do that to yourself, right? And that's kind of what you typically get from medical personnel. And so that's something that we try to do every day, is think about people who maybe don't have very many choices, and what role that they could play in helping others. Because my experience and what I find is that when you're trying to help others and doing things for others, that it's a lot of fun.
Do you get interviewed a lot?
No, not so much.
You loop back. You tied. I don't even have to be here today. You are doing such a great job of reminding everybody what the question was and all of that. You're spectacular.
Well, thank you.
We daisy chain the shows together, and yesterday on the show we had a guy. He's a Peruvian guy. He's starting a Peruvian restaurant. We talked about that. We talked about his childhood, stuff like that. But when we got to the topic of you, he really fumbled over right, like the words to use and how to say it, and he felt really uncomfortable, and I just felt that stigma and all of that around it. And he's a great guy, not that he's not pro what we're talking about today. It's that he wasn't kind of comfortable with it. Mm-hmm. And so we finally got to a question that he could ask you, and his question to you was, as you meet these diverse set of people, right? Everybody's got not a different story, but some story, their own story about how they got to where they were. How do you have the skill set, or the patience is the word he used, but I don't know if that's the right word, to meet them where they are and to figure out what they need? How do you prep for that every single day?
Sometimes it is hard, Jerry, too, because one of the things I can say about Harm Reduction Michigan is we try to do a lot with very little. And so we're stretched pretty thin as far as management, and as far as, like we have an office and we don't have people just sitting in the office, like waiting to answer the phone or whatever, so it could be challenging because I find that I'm always on the move and always on the go, and like going pretty fast. That's probably one of my downfalls. And so sometimes I catch myself like, you got to slow this down, because that doesn't allow for the details and the time that you really need with people, to kind of understand what's going on. And so that can be a challenge, but it's really, I've been doing this a long time. I've been doing this really, syringe access work since 94, and harm reduction work since 94. And as I worked through my own recovery and my own process of understanding my disease, if you want to call it that, or, that some people are not comfortable with the disease model. I used to object to the disease model because from my perspective, it alleviated my responsibility for helping myself. If I could think about it as, okay, I'm Irish, I got a family full of drinkers, I was born with addiction. Oh, not my fault. Not my problem, right? It was just a really easy way to shirk responsibility. So I was resistant to the disease model for a while. But however you want to think about it, it's a process. And so understanding people along that process, and we're all going to make mistakes. We're all human. If we were perfect, we wouldn't be here any longer, And so most of us have things to learn, and so when you make a mistake, I like to think about it as a learning curve, and so we make mistakes every day. I'm sure I do, and but it just kind of depends. But I feel like, that's part of what this is about, is the opportunity to grow spiritually, and so addiction is really, when done right, it encompasses the spiritual realm substantially. And so you're going to get serendipitous things happening, and you're going to, I like Deepak Chopra says, there's no such thing as a coincidence. It's their messages from the spirit realm. And I'm totally on board with that, and so I believe that, you know what you know when you need to know it, and things will disclose themselves, and it's I think that there's some benefit. And I mean, I used to be frustrated as a younger person who was trying to change my life and get and stay in recovery for myself at an earlier time in my life, at a time where there really wasn't any harm reduction yet, and where there was kind of only 12 steps and abstinence-based treatment. And so I know that world because it was a part of my formation, so to speak. And I can see a lot of deficits from it, but I can also see some assets there. But as we're all learning, as we make our way through all these changes out here in our society, it's a process. And so being patient with yourself and being patient with others is a big piece of that.
You're amazing. You are so amazing to me.
Thank you, Jerry. I feel the same way about you and Shannon and the Fledge.
I want to show you, Sean Watson Davis is on the show tomorrow, and she's been doing work with she went through the journey of Alzheimer's and dementia with her mother, and we're going to talk about that tomorrow. But she thinks you're doing awesome work, and this is a lead into the next thing where I want to pass a question from you onto her tomorrow. And I do this because I don't want to be the only one asking questions, because I'll get channeled and I'll set the paradigms. And I guess I want to make room for others to ask the question. So what question would you like me to pass on to her?
Jerry shared a little bit about what your show is about tomorrow. And I have to say that this question is born somewhat out of, I'm in somewhat of that situation myself right now. As I mentioned, my mom is 95, just turned 95, and lives here, which is why I'm here. And my question would be, if you could go back to a time where she was as lucid as she ever was and ask her a question, what would it be?
And I'm going to turn that question directly back at you. The exact question. Now that you've told me about your mother and your relationship with your mother, what would you ask?
I don't know that I would have one specific question. And the other thing that complicates that question is, culturally, we all come from different places, right? And my mother is of the culture in this country, so she's World War II era, really. And she was born in 1925, and she's not She doesn't share emotionally. She comes from a family that really didn't do emotions, which is really not a surprise when you look at the history of addiction in our family. You know, the roots of addiction are in the emotional realm. They're really not in the physical realm. And so it's important to understand that when you're trying to make advances in addiction work. But so although I would love to ask my mother some specific questions about her childhood and her relationship with her parents, really, probably mostly, I honestly don't feel like she has the emotional toolkit to answer it very specifically, because they just didn't operate with that kind of an emotional toolkit at that time.
Yeah.
And certainly not in her family. If they did in other families, they did not in her family. So I don't know that I could ever get that answer, honestly, from her.
Yeah.
You know,
I think Sean's going to have, that was a great answer. Sean's going to have a great answer for that too. And I really appreciate passing that question to her. You have an impact on me. You teach me stuff. Even today, you've taught me some things about social entrepreneurialism that I'm going to use. I always plagiarize from you. Sorry. I give you lots of credit, though. Give you lots of credit. As we wrap up for the show here, our longest show, which I knew it would be, and we didn't do too bad. Knuckles to you for not crying all day with me, because that's what I really want to do, I think. What would you like to leave us with?
I would just like to leave everybody with, we're excited. We're moving into a new administration. We're moving into a new year. We've had some gifts from this year. I know a lot of people have been frustrated, but it's really been a gift in a lot of ways. We've gotten a lot closer. We've gotten a better or a different understanding of ourselves when the reality of going out and going to places, which is like just another way of distracting ourselves, right, was taken away. We were kind of forced to get resourceful. And so it's been an interesting, and I've enjoyed this year. But, you know, we've got a lot of positive stuff going on. I'm pretty excited. I got my COVID vaccine on Tuesday. So we've got these vaccines out here, you know, we're moving in the right direction. I was reminiscing about the days of the Clinton administration, because the money in HIV was like so phenomenal. There was money to do all kinds of HIV AIDS work. And so I'm looking forward to an administration federally that prioritizes people being well and understanding racial injustice and social issues, social injustice as well. And so that's exciting to think about us moving forward, and that, you know, we're in a pretty exciting place, and we can look forward to these next 4 years in a lot of great ways. So,
you know, there's an old Russian saying that says, hope is the last to die. And you just filled us all with hope. And I appreciate you so very much. I love you so much.
I love you
do a
too,
lot
and
for
Shannon
me.
as well, and the Fledge. So thank you so much for what you're doing and what you've done there in Lansing, and for being partners. So always excited to work with you guys. I love you guys. Happy holidays.
Happy holidays to you, Pam. Thank you so very much.
Thanks for having me.
Yeah, just stick with me